Good day. Topic of our lectures is inflammatory disease of the musculoskeletal system. It's Department of Dermatology and Orthopedics. First part of its lectures is tuberculosis. Tuberculosis of bone and joints. It occurs as a result of the hematological disseminations of mycobacterial tuberculosis during primary infections of the organism or during the period of activations of long-term latent tuberculosis force. Primary bone has osteoitis. Always appears in spongy bones, vertebra, or epiphysis or a metaphysis of long tube bones with a well-developed circulatory systems. This is an accumulation of epithelioid tuberculosis, consisting of epithelioid cells, among which emit multinucleate gigantal heart cells. Epithelioid tuberculosis create a tuberculosis granuloma. In the tuberculosis occurs necrosis. They match, forming significant fossae in the epiphysis of vertebra. Kornev identifies three phases of tuberculosis arthritis. The first phase is pre-arthral. It is characterized by an isolated primary focus in the epiphysis metaphysis. Synonym pre-articular or extra-articular focus. You look, it's coxa joints. Adult it's or a child. It's child. While zone of groove, look first, and on femur it's zone of groove. But it's osteoitis. It's tuberculosis of bone. The second phase is arthritic. Tuberculous granuloma extends from the pineal gland to the joints. Clinical picture of arthritis, characterized by three periods. Begin, difference, characterized by destructive process, and decay. Fibrous encapsulations of necrotic fossae is observed. Look, it's coxa joints too. It's child too. Why? It's zone of groove. It's tuberculosis. But you look, he not isolated on bones. It's open and included all joints. It's secondary phase on arthritis. The third phase, post-arthritic. As a result of destructive process, deformations, dislocations, and subluxations occur. The fossae are encapsulated, the pathological process fades, but remains of source of recurrence provided the body's reactivity decreases. Look, it's coxa joints too, but look, deformity caput of femur, deformity neck of femur, acetabulum deformations have too, and patient have dislocations femur. Its joints not have normal functions. Tuberculous coccitis. It occupies one of the first place among osteoarticular tuberculosis, 20%. In 99% of all cases, osteoitis occurs in the acetabulum, and only in 0.04% of cases in the femoral neck. Expansions to the joints occurs in two rods. First, the germinations of tuberculosis granulations in the synovial membrane and breakthrough of purulent masses through the necrotic closing plate and cartilage. Symptoms of the prearthritic phase. Joint discomfort. Rapid fatigue of the limb. The patient is training to transfer the main load to healthy joints. The next step. Pain, often radiating to the knee joints, limbs, limiting the amount of movement. Hypertrophy of the gluteus and thigh muscles. Positive Alexander syndrome, thickening of the skin fold in the thigh. On palpations, local pain in the area of the lesion when placed close to the surface of the joints. The general conditions does not deteriorate. There is not hyperthermia and intoxications. ESR slight increase. Minor leukocytosis. On the radiograph in the metaphysis, an oval-shaped rounded lesion in the visualized limited from the healthy bone by a thin sclerotic strip. In the cavity can be causes. Masses indicate the durations of the process osteoporosis. Symptoms of arthritic phase. Growing pain, intoxication symptom increase in body temperature, fast fatigability locally, increase in temperature, particular infiltrations, contracture of a joint with a fluid installations of the limb, muscles hypertrophy increases. Formed tuberculosis sequester, intestines, abscess, fistulas. X-ray symptoms of arthritic phase. Deformations of the joint-formed bones, dislocations are formed, with the destructions of the bottom of the acetabulum and central dislocations of the hip occurs. Symptoms of the post-arthritic phase. Inflammations, attenuations, reduced pain process, increased limitations of movement, contracture, fibrose, ankylose, bone ankylosis, shortening the limb. Radiological symptoms of the post-arthritic phase. The absence of increasing destructive process. Reductions of osteoporosis with clear contours of distorted areas of the articular ends with preserved focal change in them, especially in the place of primary osteitis, in the form of cavities of bile-like depressions with the presence of causes masses and sequesters. Knee joints tuberculosis. The frequency reaches 20%. The primary focus is localized in the epiphysis of the femur, 29%. The proximal epimetaphysis of the tibia, 61%, and in 7% of cases in the patella. You look, it's tuberculosis knee joints. On right picture, show fibrous ankylosis by you determine line of joints. On left picture, you look joints on both sides. It's bone ankylosis. You not determine line of joints. It's synostosis. Tuberculosis sacroiliitis. make of all cases, described by Boyer about 200 years ago. It is characterized by a heavy current. Tuberculosis spondylitis, Pott's disease. Frequency from 20 to 45% all cases. The mentions of this pathology is Hippocrates. The first scientific descriptions of the clinical symptoms made by Professor Pott disease in 1799, a secondary disease that occurs by hematogenical during the period of early generalizations from the primary focus of in the late period into the outbreak phase of the process in the lungs or bones. In 62% all cases, according to Corliss, guts are formed. The appearance of fistula indicated a transition to the most difficult phase, with the development of terrible complications, secondary infections and sepsis. In case of damage to the vertebra reduce. Prescriptive phase, spondylitic phase, and post-complaint phase. You look, it's tuberculosis spondylitis, but on right side you not determine tuberculosis. It's X-ray tomography, and you determine damage both body of vertebra. Tumor, not damage on one moment, two and more vertebra. On the tuberculosis, damage you look, it's both vertebra. Treatment. Complex necessary begins the conservative treatment, which active tuberculosis coccides, a combination of 3-4 tuberculostatic drugs, is prescribed for up 8-10 months, with subsequent prophylactic courses. In the non-acute phase, or in the presence of the consequences of the disease. The treatment is carried out as a preoperative preparations of the patients and continues in the postoperative period for 3-4 months. Plus antihistamines, angioprotectors, antioxidants, vitamins, hepatoprotectors, anti-inflammatory. Maybe presence, maybe not presence intoxications. If presence of intoxications, obligatory must prescribe disintoxications therapy. Orthopedic treatment. Immobilizations of the affected joints until the inflammatory process subsides 3-4 months. In the subsequent exercise therapy, physiotherapy, spa treatment, surgical treatment in the early stage, extraarticular removal of the pathological focus with the defectoplasty, with joint damage, canonical reconstructive resections of the joints of reconstructive restorative operations. Sequesterectomy, eliminations of the perverse limb positions. It's finish first half lectures. It's tuberculosis. Next, osteomyelitis. The term suggested by Renaud in 1831 implies inflammatory damage to all bone structures and adjacent tissues. The pathological process is accompanied by osteolysis and osteonecrosis. Types of osteomyelitis. Hematogenical osteomyelitis, the penetrations of microbes into the bone marrow by blood flow from an inflammatory focus in the body. Traumatic osteomyelitis occurs with open gunshot fractures, purulent wounds, and postoperative complications. Hematogenical osteomyelitis. Pathogenical microflora is spread by blood from the source of infections, obvious umbilical sepsis, pyodermia, abrasion, wound, boil, carbuncle, phlegmon, erysipelas, hidden chronic tonsillitis, inflammatory process of the urinary system, karyosis. Researches by Brief and Honda showed that there are no final vessels in metaphysis, but there is a wide network of anastomosis with epiphyseal vessels. Therefore, the embolic theory of hematogenical osteomyelitis, Lasser and Petrov, is not justified. Further, Van showed that microbes from the sinuses, there they settle, especially with osteoporosis, penetrate into the perivascular spaces, cause a disruptions of the blood supply. Ischemia with contributes to the development of pathogenical microflora. Osteomyelitis occurs as a result of extravascular occlusion, but inflammatory infiltrations in a closed perivascular space. You look, it's hematogenical osteomyelitis. It's ankle with osteomyelitis, typical fistulas, and X-ray. Damage and change bones if patients have chronic inflammatory process. Forms of hematogenical osteomyelitis according to Krasnobaev. First, toxic form. Secondary, it's septic PMическая form. And third form, hematogenical osteomyelitis is related of multiple. Toxic form. Acute onset, chills, high fever, loss of consciousness, rapid pulse, low blood pressure. In the first days of the disease, death can occur as in septic shock. Hyperemia of the face, petechia of rash on the skin, shallow, frequent breathing. Septicopemic osteomyelitis. Acute onset, chills, fever, vomiting, shallow breathing, low blood pressure, pallor of the skin, psychomotor agitations, acute pain, swelling at the site of the pathological process, the presence of purulent metastasis, CBC increase in the SR, shift to the left. Hematogenical osteomyelitis. Acute onset, high temperature up to 39 degree, lack of urine sweat and damage to the central nervous system, chills not pronounced, local pain and swelling. X-ray symptoms. Occurs 2-3 weeks after the onset of the disease. The destructions of bone tissue. After 3-4 weeks, sequester of 3 types: cortical, central, and total. X-ray symptoms. You look 3 types of stimulate: post-operative, traumatic, and post-traumatic. Treatment of stimulates: obligatory antibacterial therapy, osteoperforations of the bone in the early days of the disease, immobilizations, active immunizations, hyperimmune Staphylococcus gamma globulin, Staphylococcus amatoxin, antistaphylococcal plasma. Surgical treatment, osteonecroectomia, extrafocal fixations on device by Ilizarov. Classifications, post-traumatic osteomyelitis. By time, acute, up to 2-3 months. Subacute, from 2-3 months. And after 4-6 months, it's chronic process. Patients not have relief osteomyelitis. If put diagnose osteomyelitis, its diagnosis and process following for its patients all life. And if not have symptoms, maybe 15 years, patient have chronic osteomyelitis. FAS, have active FAS, is only if patient have fistula. Extracerebrations with severe symptoms of general or local inflammations, and attenuations, lasting remissions. General deteriorations, chills, fever, vomiting, shallow breathing, acute pain, swelling at the site of the pathological process, increased purulent discharge from the wound, swelling and pain, granulations, sluggish, do not bleed. The bone in the wound loses its luster. Dull, crumbles, fibrous darkness with time and becomes route it destabilizations. Last to form a defect. CBC, anemia, increased ESR, leukocytosis, left shift. X-ray lysis, defect osteoporosis, sequester, and form are formed. On this picture, you look patient who have chronic post-traumatic osteomyelitis. It's fistula. Patient have edema. Look, it's fibrous process after extrafocal device by Ilizarov. Complications of chronic post-traumatic osteomyelitis. Amyloidosis. Limb deformations. Dysfunctions of the joints. What dysfunctions of joints? All joints have normal amplitude of movement. If patient have decreased amplitude or increase. If increase, its name hypermobility. Definitions. If decrease amplitude of movement on joints, it's contractures. If patient have only valve movement on joints, not more than 5 degrees, its definitions rigidity. If patient have absent movement, its definitions ankylosis. Ankylosis have two types. First, fibrous ankylosis. If you examinations patients and examinations its joints, movement absent. But if you made its examinations, patients feel pain, and on X-ray control you determine line of joints, it's fibrosis ankylosis. If patients absent movement, if you made examinations absent pain on its joints, if you want extend or a bend, and on X-ray fields absent line of joints, have synostosis between bone who formed its joints, it's bone ankylosis. It's dysfunctions of the joints. Pathological fractures, maybe malignancy, have rules. If patient have fistula more than 6 months, very increased risk malignancy. And fistula more than 6 months is indications for amputations. If not more than its time, maybe made conservative treatment. Next complications is sepsis. Treatment. Antibacterial therapy obligatory. Latin said, ubi pus, ibi incision, where the pus, there is an approach. Osteoperfusions of the bone in the first days of the disease, osteonecrectomia, extrafocal fixations on device Ilizarov, immobilizations, ismoid plaster of Paris, active immunizations, hyperimmune, staphylococcal gamma globulin, staphylococcal anatoxoid, antistaphylococcal plasma, in remission spa treatment. It's general questions, our lectures. You have questions? I wait. If you have questions, you write. I wait few minutes. Prepare questions, I answer. I look absent questions. Good luck. Finish my lectures.